Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County, with another of our COVID conversations today for February 16th, 2023. We've been doing this now 3 years, and the news is nearly uniformly good. For the last 6 weeks now, we've had a low level of COVID cases, and we're not seeing hotspots really anywhere in the world. And that's good because you'll remember in the past when we would have a low time, there'd be another part of the world that had a new and worrisome variant. And we were pretty sure that it was going to get here at some point and we were going to have an increase in disease. But now we're at a time in the pandemic where we have a low amount of disease, the world has a low amount of disease, and there are no real hotspots in the world. The one hotspot that we did worry about in December, January was China. As you remember, China had a very restrictive early policy. In December of this year, they let up on the policy and had a huge surge of cases. Now, we have no idea how many cases there were, but there's some news reports today that they had about 1.5 million deaths. Well, it seems like a lot of deaths, but you'll remember it's a country of over 1 billion people. And so 1.5 million deaths is high, but relatively low in comparison to other countries that struggled throughout the pandemic, such as the United States. But right now, things are quiet in the world. Things are quiet at the national level, they're quiet at the state level, and they continue to be quiet in Douglas County. Now, quiet in Douglas County doesn't mean it's gone. We're still seeing 5 to 15 cases a day. We still have a few people in the hospital, and we're still seeing deaths. So this disease is not gone. So when diseases when diseases subside, they can subside in a couple of ways. One is they can go totally away. So, for example, smallpox was a disease that was totally eliminated from the world. This will never happen with COVID because there are asymptomatic cases. Cases can fall to a level where it doesn't circulate anymore in areas such as polio in the United States, but still exists in other parts of the country. The third and more likely is that it continues to spread, but at very low levels that don't really disrupt things, don't cause lots of deaths, don't cause lots of disruption, and don't really disrupt our hospitals. And I think that's probably where we're going to be with COVID. So I think we're always going to have a little bit of COVID in the background. It may change, and there's certainly a possibility of a new serious variant, but we're not seeing any of that right now. The variant that's out there now is the XBB variant. This started in Singapore as a combination of two of the BA2 variants. But we're really not seeing many new variants out there, and that's the good news. So the predictions that we're seeing from the CDC and from the people in Oregon is that we'll have a relatively quiet springtime, and that we don't really need to worry much more about COVID. Now, still, with hospitalizations and deaths, there are protections, and we are recommending that if you've not gotten the bivalent booster to go ahead and do so. That's been really very safe and very effective at preventing hospitalizations. And if you do get COVID, to really think about talking to your doctor about using Paxlovid, because what we've seen is that really has decreased the number of hospitalizations and deaths for the people who've had it. The other questions that came up this week is, well, what about flu and RSV? Flu is pretty much gone. We've really not seen very much flu over the last few weeks. That's a good news. You know, we worried about a second peak in January or February, and we're not seeing that. And the next one is RSV. Again, RSV, or respiratory syncytial virus, a virus which really attacks the very young and the very old, spread widely in December and is coming down. Now, RSV, because it's contagious for a long period of time, doesn't go away quite as quickly. And we're still seeing occasional cases of RSV, but the number of hospitalizations are really way down from where they were just 6 weeks ago. So again, we're all pretty much good news at this point. COVID is down, RSV is down, flu is down, and we're looking forward to a good and healthy springtime. So, this is about the first time in the pandemic I've been able to say for 6 weeks running that the news is good and there are no dark clouds on the horizon. So again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you.